Chapter 16 covers the special senses, and mainly we'll be focusing on the eye and the ear. And we'll start with the structures of the eye. The outer portion of the eye has 3 layers, which are referred to as tunics. The outermost layer is called the fibrous tunic, and it consists of 3 different structures. The cornea is the clear outer covering just on the anterior portion of the eye. The sclera is the white part of the eye that surrounds the majority of the eye. It's shown in the light blue color on the PowerPoint. And the conjunctiva. This refers to the mucous membranes that cover the outer surface of the eye, and they also line the inner eyelid. The middle layer of the eye, shown in this pinkish color, is called the vascular tunic, and it consists of the choroid and the iris. The choroid provides a blood supply for the entire eye, and this layer is pigmented, so it has a dark pigment in it. And the iris forms the anterior part of the vascular tunic. The iris is actually the colored part of the eye that you can see. And right in the middle of the iris is the pupil, which is a small hole that can constrict and dilate to control the amount of light that enters the eye. And then finally, the sensory tunic is the inner layer of the eye, and it is made up of the retina, which consists of 2 layers, an outer pigmented layer and an inner nervous layer, which contains neurons. Within the nervous layer, there are receptors for vision, which are called rods and cones. Here is a closer look at the structure of the retina. The rods, which are shown here and here, these gray structures, these function in dim light and they produce black and white images. Whereas the cones, which are shown in the various colors here, these function in bright light and they produce color images. All right, a little bit more about the anatomy of the eye. There are 2 chambers within the eye. The anterior chamber is in the front portion of the eye. It's actually right in front of the iris. It's between the cornea and the iris, and it contains aqueous humor, which is a clear watery fluid. The posterior chamber is located in the back of the eye, behind the iris and the lens. This is a pretty large chamber that contains the vitreous humor, which is a more jelly-like substance. The lens is right here. It's a round, clear structure located behind the iris, and it helps to focus light right on the retina, which is in the back of the eye. All right, other structures associated with the eye are the lacrimal glands, which produce tears to lubricate the eye. Lacrimal canals will drain tears into the nasal cavity. And the optic nerve is here. It's located at the back of the eye, and it sends sensory information to the brain for interpretation. Moving on to the ear, it's within the ear that you have receptors for hearing and equilibrium, which are 2 of the 5 special senses. There's 3 divisions. The external or outer ear consists of the auricle, which is the cartilage that's located outside of the head, and it collects sound waves. So this is the part of the ear that you can actually see. The external auditory canal carries sound waves to the eardrum, which is called the tympanic membrane. It's a very thin membrane that vibrates in response to these sound waves. And this actually marks the separation between the external ear and the middle ear. So the middle ear comes next, and within the middle ear you have the ear ossicles, which are 3 tiny bones that the eardrum transmits vibrations to. And then also here is the eustachian tube, which connects the middle ear to the nasopharynx, which is the upper part of the throat. And this equalizes air pressure on both sides of the eardrum. And then all the way in here is the inner ear structures. It's here where you have what's called the labyrinth. The cochlea is the snail-shaped structure. It's filled with fluid, and it contains the organ of Corti. And it's actually within this structure that you have the receptors for hearing. The vestibule is the rounded area located here that contains receptors for static equilibrium, and the semicircular canals, which kind of extend off of the vestibule. These are 3 canals that contain receptors for dynamic equilibrium. Okay, so some key terms associated with hearing, equilibrium, and vision are accommodation. Accommodation is the adjustment of the eye for various distances to allow light to fall right on the retina of the eye. Acuity refers to sharpness of vision. Adnexa refers to the tissues in the body located near a related tissue. Humor is any fluid of the body. Labyrinth is a series of communicating or connected passages. A photopigment, this is a light-sensitive pigment located in the receptors found in the retina that initiates the visual process. Remember, a tunic refers to a layer of tissue. These are layers of tissue in the eye. And the term refractive refers to the ability to bend light rays as they pass from one type of matter to another. Okay, and then here you have several word roots and combining forms that are related to the eye. Here are some related to the ear, and also some prefixes and suffixes that are commonly used to refer to hearing and vision and equilibrium. All right, so now some of the pathology related to the eye. We'll start with some of the errors that can occur with refraction. So these occur when light enters the eye, but it doesn't land directly on the retina. There is hyperopia, which is farsightedness. This is when the eyeball is too short and light lands behind the retina. Myopia, this is when the eyeball is too long, so light lands in front of the retina, and this is called nearsightedness. Presbyopia is a form of farsightedness associated with aging, and astigmatism is when an individual has an abnormally shaped cornea or lens, which causes light rays to spread out over the retina instead of landing in one spot. So that can cause blurry vision. Cataracts is a clouding of the lens due to a protein buildup. So that can impair vision. And then glaucoma is when there is increased intraocular pressure. And that's often due to the failure of the aqueous humor, the fluid that's in the front of the eye, to drain properly. This can cause damage to the optic nerve, which could potentially lead to vision loss. All right, a few other terms. Strabismus is a condition where one eye is misaligned with the other, so the eyes do not focus simultaneously on one object. And macular degeneration is a deterioration of the macula, which is the most sensitive portion of the retina. This is usually age-related, so more likely to happen as you get older, and it does result in loss of direct vision. You still have peripheral vision, but direct vision is lost often. Okay, some pathology related to the ear. Um, so we'll start with otitis media. This is inflammation of the middle ear, typically due to an infection, either bacterial or a viral infection. And otosclerosis is a hardening of the ear ossicles in the middle ear, which typically results in hearing loss. Okay, and here we have just a few other diseases and conditions. Conjunctivitis, this is pretty common. It's known as pink eye. This is inflammation of the conjunctiva due to an infection. Ectropion is eversion of the lower eyelid, and entropion is inversion of the lower eyelid. Nyctalopia is impaired vision in dim light, also called night blindness. Nystagmus is involuntary eye movement. Photophobia is sensitivity to light. And retinopathy is a disorder of the blood vessels in the retina. Okay, and then a few associated with the ear and hearing. Anacusis is complete deafness. Labyrinthitis is inflammation of the inner ear. Otitis externa is infection and also inflammation of the external auditory canal. Presbyacusis is hearing loss due to old age. Tinnitus is a ringing in the ears, and vertigo is a sensation of a spinning motion. So it results in dizziness. And then a few procedures, medical, surgical, diagnostic. Irrigation is flushing of the ear canal. That's used typically to dislodge a mass. It could be earwax, for instance. Pressure equalizing tube placement is insertion of tubes through the tympanic membrane. That's often used to treat otitis media. A cochlear implant is a hearing device that produces hearing sensations by electrically stimulating nerves in the inner ear. Enucleation is removal of an eyeball, and a radial keratotomy is incision of the cornea for correction of vision. A few others here. Audiometry is a measurement of hearing acuity. Otoscopy is a visual examination of the external auditory canal and tympanic membrane using an otoscope, which is shown here. Caloric stimulation test is the use of water to test the integrity of the vestibular nerve. So that will tell you how intact that nerve is. Tonometry is a test of intraocular pressure using applied force. So this can help test for glaucoma. And ophthalmoscopy is a visual examination of the interior eye using an ophthalmoscope. And finally, a little bit about pharmacology for vision and hearing. Anti-glaucoma agents decrease aqueous humor production. Mydriatics, these cause pupil dilation for eye examination, or it can help treat inflammatory eye conditions. Ophthalmic antibiotics inhibit growth of microorganisms that can potentially infect the eye. Ophthalmic decongestants cause vasoconstriction to relieve redness, itching, and irritation. Otic analgesics relieve pain and inflammation, and wax emulsifiers loosen and help remove impacted earwax.